All right, Hygiene Elevated Conversations and Innovations. We've got Hayley with us today from Oral Care Elevate. Did I say that wrong?
Joffrey
Elevate
didn't
Oral
grab
Care.
her water bottle from
Did I
Elevate Oral Care.
did I tell you I'm a little dyslexic? Anyways, Hayley, thank you so much for joining us tonight. And
Thank
then
you
tonight's
guys.
yes, and tonight's topic we want to talk about silver dynamine fluoride. So can you give our listeners just a brief summary on what it is and how it's applicable in dentistry?
Yeah, definitely. Silver diamine fluoride is a pretty exciting product that's a newer innovation in the United States. But other countries have been using it for several decades. Japan, for example, has been using it for over 70 years. And in that time, there has not been a single adverse event reported. So it's also an extremely safe product to use. It became available here in the United States. It was FDA cleared in 2014 and then first became available in the United States from Elevate Oral Care with our Advantage Arrest silver diamine fluoride product that was in 2015. And it's FDA cleared here as a dental hypersensitivity treatment. So that's the same way that fluoride varnish is FDA cleared in the United States. But as you guys know, clinicians use fluoride varnish all day, every day, off-label to prevent decay. But it is FDA cleared as a hypersensitivity treatment. And silver diamine fluoride is also most often used off-label, but to arrest decay. So it's a liquid formula. It's really the consistency of water. Or at Elevate Oral Care, we just launched a gel formulation as well, which just has a much more viscous formula. But either way, it's this liquid or gel formula that you apply to a carious lesion. And within like 24 to 48 hours, it will arrest the infection in that tooth and harden and remineralize that tooth surface in about a week's time. And then it will discolor the lesion permanently black once it's arrested and be completely remineralized. So it's a minimally invasive way that we can treat and arrest tooth decay. So it's pretty exciting.
That's incredible.
Yes.
Just like all future applications of that product.
Mhm.
What do you think like the reason that it hasn't been in the United States before now,
Mhm.
especially since it's been being used for the past 70 years in Japan?
Yeah. So I think a lot of that has to do with FDA clearance. You'll hear now a lot of big pioneers with silver diamine fluoride here in the United States. They'll tell you they've been smuggling this stuff in for a long time. So it has been around. But I will say, though, back in like the 1920s, people were using silver nitrate with fluoride. And that was kind of the precursor to silver diamine fluoride. But it needed the fluoride to help really strengthen the tooth. But that was also around the time that local anesthesia became big in the United States, and kind of the local anesthesia route took over in place of really this minimally invasive route. So the silver nitrate and fluoride and later the silver diamine fluoride kind of fell to the background while the local anesthetic and repairing these teeth with restorative dentistry really took off and took over. And then also FDA clearance that took a while for it to happen here in the United States. And so now that it's here and it's available, now it's much more used much more.
My office back in New Mexico, my doctor would actually use the silver nitrate.
Mm-hmm.
In specific situations, we had a lot older population where I was working. And, it's not always appropriate to replace a crown.
Mm-hmm.
There's a time and a place where it's like, how much longer does this person have? So we're not going to, make them go through the whole situation. Or maybe they're just medically unstable and not able to go through a crown procedure. And you don't want to risk having to do an extraction in the future because of the medical history. And he used a decent amount of the silver nitrate, and that would stain anything black. Would never come out of anything. So I was very interested. You kept talking about silver diamine fluoride when we would go to dinner in Florida. And I was like, what is silver? And I don't know why we didn't ask you more about it then, but we were waiting for a podcast, clearly. So So what would you say? I mean, you've kind of highlighted a little bit. What are the key benefits and advantages of using silver diamine fluoride? We can just say SDF compared to traditional dental treatments and procedures.
Yeah, so there's a lot of great benefits to it. And this is never going to take place of restorative dentistry. Like that's some people's fears, like, oh, I can't use that stuff because restorative dentistry is where I make my money. And this is my how my family eats and whatnot. And there's no way that this will ever completely take place of restorative dentistry. There's going to be a time and place for both restorative dentistry and silver diamine fluoride and some of these other minimally invasive options that are out there. But I really like the way, Amanda, that you brought up the previous office you worked in and they were using this on older patients, because that's something that I think is still newer to a lot of people. When they hear SDF, they think, oh, this is for those pediatric patients and pediatric offices only. And certainly this is wonderful for pediatric patients. But there's so many wonderful uses for our aging population as well. And even for people like our age people, like you guys and myself. I mean, there's great times and indications when this can be used also. But it really comes down to, this is just another tool we have in our tool belt. And really ethically, as clinicians, when we see a patient, we are supposed to be able to explain to our patients really all the options that are available to them and let them make the informed decision on really what's the best decision for them. I mean, if we were going to our medical provider and we found some infection somewhere, we wouldn't just want them to say, hey, this infection you have in your wrist, we have to amputate your wrist. I mean, that's the only option, because really that's kind of what restorative dentistry is. It's just like, we got to remove this part of that tooth and that's it. But really there's a lot of different ways that this can be used, and in certain situations, it can be an opportunity where patients who are very apprehensive about restorative care, maybe financially can't commit to restorative care, whatever the case may be, there's times when this can be a really good option for those patients. And there's really a number of different ways that it can be used. And we talked about using it as a desensitizer, because that's how it's FDA cleared. It's a great desensitizer. And I know, Amanda, you mentioned some discoloration with the silver nitrate that takes place. And I briefly touched on it too with SDF. It will permanently stain a carious lesion black once it's arrested. And there's options to restore over that later down the road too. And we'll kind of talk through that a little later if you guys want. But it will permanently stain that black, but it does not stain sound, healthy tooth structure at all. So if you are using it to treat dental hypersensitivity, it's a great desensitizer. They experience sensitivity relief pretty much instantly, and it will not stain or discolor that tooth surface unless it's demineralized or decayed. So that in itself is pretty neat. Yeah. So with that too, it can be used to arrest decay like we talked about, and that's when you'll see that permanent staining take place. But it also has some pretty profound preventive benefits as well. There was a really great article. It was in the California Dental Association journal back in 2016, so not long after this was available in the United States. And they were talking through all of the different benefits and uses of silver diamine fluoride. And there's a section of that article that talks about the caries prevention that's seen. And that article said that annual application of silver diamine fluoride prevented many more carious lesions than if you were to treat a patient with 4 fluoride varnish treatments in a year. So just stop and think about that for a second. Varnish is our gold standard in prevention right now, and that's what is recommended by the ADA for prevention. But SDF has shown to offer greater prevention than if you were to treat a patient with 4 fluoride varnish treatments in a year. Now, with that being said, you're not applying it like fluoride varnish all over the dentition, but it's a site-specific application anytime you're using it. So site-specifically, you can apply it to arrest lesions, to sensitive areas, or high-risk areas. Like think about furcations, where you have patients where you're like, okay, they're not keeping that clean at home. I'm having a hard time keeping it clean in the chair. You can apply some SDF in there and offer greater prevention than anything else we have to offer to that patient. So that's a pretty neat way to use it as well.
That is a really great, really great. I actually had a patient that came in, normally has meticulous hygiene. He is like notched out every classified possible. But for whatever reason on the buckle of number 30, he somehow was not able to brush right there. And he actually developed decay in the last 6 months. And I feel like that would have been a perfect example of how to use it. I mean, there's many examples, but that was with the whole class 5 buccalification. That was one that really came to mind. That would have been a really great use for it.
For sure. And I mean, think about his smile line. You wouldn't even have seen that in his smile line.
No,
So,
not at all.
Yeah.
Not at all.
Yeah.
Fascinating.
It's cool.
Oh, Hayley, so we saw in an article in the RDH magazine about the possible application of SDF as a sealant. Can you tell us more about how that works?
Yeah, so that was Shelly Long in your neck of the woods, I believe. I think she's from Utah, like you guys. She's awesome, or Shelly Brown, excuse me. But she was talking about how she used it on her own children for a preventive, basically, like sealants. And absolutely, this can be used because we just talked through that preventive benefit where it can be applied to occlusal surfaces, and it can be used essentially like a sealant. Now, it's not going to be an actual barrier in there like a sealant is. It just actually penetrates through the tooth and creates this antimicrobial tooth structure where bacteria cannot colonize or demineralize that area. But now silver does leach out over time. So unlike a sealant, you would want to keep up with reapplying it. But if you reapply it every 6 months, it will act as a true occlusal barrier similar to a sealant.
Do you have to etch it as well?
Nope. You don't have to etch it. You just apply it on. It'll penetrate through healthy tooth structure. And again, it won't discolor the area if it's sound and healthy, and it will penetrate in there and it creates that antimicrobial tooth structure. So it's really neat. I've got some cool images that I could share with you guys, but and you can probably Google search them, but there's some really neat images where you can take a cross section of a tooth and they show the penetration before and after the SDF, and you can see it deep down in those pits and fissures where it's that antimicrobial tooth structure down into the depth of those pits and fissures. So it's pretty neat to see. So think about like primary teeth. We never see sealants really being done on primary teeth, but we see children obviously getting decay in their primary teeth, especially with our American diet. I mean, every child eats goldfish crackers and there's gummy vitamins now and just all these things that puts these children at high risk for decay, and those occlusal surfaces are a prime spot for them to get that. But we don't really discuss sealants on these patients because, oh, those teeth are going to exfoliate and, we'll kind of monitor if they have to do some restorative work, they do. But if you instead do what Shelly mentioned in that article, and you can apply this to those occlusals every 6 months, it'll get them through until those teeth naturally exfoliate and create that great, healthy, strong tooth structure for them until their permanent tooth comes in. And then you can keep doing SDF, or you can do sealants at that time. And that's when they're more age appropriate and can sit through a sealant as well.
Ugh, those are such great ideas, because how many times have we had, those kids come in and your heart just breaks of the situation that they're in for whatever reason. And you're just like, it's either sedation and either pull all these teeth, do some drastic crowns. But how amazing would it be to be able to get them through with some SDF preventatively as well?
Yeah,
So
think about like your special needs patients too, where, you want sealants on them, but sealants are pretty technique sensitive, a lot of them. You need this dry field with some of them. And there's so many steps that go into play, whereas this, you can slap some SDF on, cover it with varnish, that's it. So it can be quick and simple for some of those where they're harder to treat too.
I was cleaning my doctor's teeth on Thursday night, and he has 2 virgin teeth that he's keeping an eye on. And he was like, are they sticky? Do you feel stick? Like, is it sticky? And I was like, no, I don't feel stick in them. I took pictures and everything. And he's like, I think you should put some SDF on there. And I was like, I don't know what I'm doing yet. Let me do this podcast with Hayley. Let me learn. Then maybe Tuesday after, we'll have some fun with it. Unfortunately, we are not allowed to have the wonderful products from Elevate Oral Care. So we have some 2-step, very liquid, and it is a weird smell. So I am excited to experiment on my doctor tomorrow after this. But yeah, I'm very excited for that.
Yeah,
but
definitely.
I love that idea. All those applications, there's endless applications. And like you said, not taking away from restorative dentistry. There's so many other ways, I think of decreasing stress on the doctor. Like, who wants to do that many fillings on kids in that situation, you know?
Yeah.
Making everybody have a better experience in the dental office, you know? What mom wouldn't want to just have like something put over the tooth instead of drill and fill and sedation, and if you can help that, if it's appropriate.
For sure. For sure. Yeah. And to kind of explain like the appropriateness and too, so SDF can be used really into and up to an indirect pulp cap. So, I mean, as long as there's still some kind of dentin, some kind of something over that pulp, you can still use it, even if it's just gross decay sitting there, because as soon as it penetrates through there, it alters that pH and it's safe to use. The only time it's really contraindicated is if you can visibly see that the pulp is exposed. And in that case, you would not want to use it.
Gosh. Probably going off a little bit of subject here, but as far as application, is this something that, hey, hygienists are totally allowed to use? Is it state by state? Is it something that you should have a conversation with your doctor, your provider, your office? What does that look like? What have you seen so far in your experience, Hayley?
Yeah, that's a good question. One that I get asked all the time. It is a state by state decision. So I always recommend just checking with your state board to see. I will tell you though, the vast majority of states view SDF as a fluoride application. So typically, if you can apply fluoride varnish, you can usually apply silver diamine fluoride. But there's a handful of states. I know Ohio requires that their hygienists take, I want to say it's like a 2-hour course, which our Elevate Oral Care rep there, she does free lunch and learns, and her lunch and learn staff meeting course has been approved by the board. So it's really simple to, get that training. It's free. I want to say Colorado maybe has something in place like that as well. So there's a couple that have just a little certification type of a process, but most all it's just viewed as like a fluoride varnish. And if you can apply that, you can apply SDF. So yeah, that's the good thing about it. And then as far as, how it goes like in the office, I think it should really be a team decision too. I think the team should come together. I think the team should have a good understanding from everybody, from the doctor, the hygienist, the assistants, the front desk, the treatment coordinator. I think everybody needs to understand what it is, how it's used, how to recommend this to patients, and just how to have that discussion so that when patients ask, the whole team is really well versed on it. And I don't think it should be one of those things where, that one hygienist does that one thing in the office, but nobody else really talks about it. I think it should be a team decision, and everybody can really come together and see the benefits of it, and when to recommend it, when not to recommend it, and all that good stuff.
What about for codes? Is it a different code? It is a different code, because there was an article recently in RDH magazine that was discussing the different applications as well. But yeah. What have you seen as the fee structure with SDF application? Because I guess in lieu of a fluoride treatment or in lieu of sealants, what have you seen?
Yeah. So I would say that, there's a couple different, let's start with the billing codes. There's a couple different billing codes that can be used with SDF. So if you're using it to arrest active decay, so there's an active lesion there, you're going to do D1354, and that's a per tooth code. That code became available in 2016, and we've seen the coverage jump on that pretty quickly. Before really our time, when fluoride varnish became available, and it took like 20 years, I believe people are saying, before we saw the code seeing reimbursement. So we're seeing reimbursement on that code, and that happened quickly. I would say over half the state Medicaid programs, well over half the state Medicaid programs now cover 1354, and over a third of private insurance plans cover 1354 as well. So we've got coverage on that. And then 2021, they came out with a code that was for SDF prevention, which is 1355, and that also is a per tooth code. So if you're using it where there's not active caries, you're using it for prevention, you would use 1355. The beauty of both of those codes is they can be used in conjunction with your varnish 1206 code, which is important because really the patients you're using SDF on are your moderate to high risk patients. those are the people that should also be receiving their fluoride varnish treatment. So I love that those codes are eligible to be used together, to be reimbursed for both of those together. I think that's important.
That is huge. That is a huge benefit.
Yeah. So that's been really neat. So yeah, certainly, bill your fluoride varnish, do your fluoride varnish. You would want to treat your SDF sites first. And then it's really been recommended in the last few years too, to cover your SDF application with varnish, whether or not you're doing fluoride varnish, because that acts as like a little protective layer or seal over your SDF. And then the other neat thing is it helps to mask the flavor of SDF, because SDF is not good. It has a very strong metallic taste from the silver, so it's not good. So the varnish over it does a good job of masking that. But you can't bill your varnish, of course, unless you're doing the full mouth varnish afterwards as well. You don't want to waste that benefit for that patient.
So if you're using your SDF as like a sealant, would you use 1355?
Yes,
Okay.
you can't really bill it as a sealant because it's not a sealant. But yeah, you're using it in that sense for preventive benefits. So you would bill 1355 for the teeth that you applied that to.
Okay.
Yeah. Yeah. And that one's a newer code. So you're not going to see the coverage you see with 1354 because it's 2 years old now, but we are seeing people pick it up, and, slowly but surely that will find its way. And then as far as what people typically charge, I would say the national average that people are charging a patient is about $40 per tooth. And with Advantage Rest anyway, it breaks down to I think it's like 86 cents a drop, and each drop treats like 5 teeth. So
yeah,
it's affordable. And you see a good return on your investment too. I mean, for $40 a tooth, that's not bad. And then we've seen reimbursement all over the map. I mean, some people will reimburse just a couple dollars, and some people are reimbursing a lot of dollars. So it's been all over, and that just kind of depends on the insurance plans.
Yeah, it's a story of insurance, right?
Yeah, right. Yes.
Do you see any like advances in SDF? I mean, this is already like kind of changing the game for us in prevention. It's such a great tool in the hygienist like war chest, if you will. But do you see like any other advances or applications coming down the pipes?
Yeah. We're working on an exciting new venture. I mean, the gel is brand new. That launched about a month ago, and that's been a big kind of innovation with it, because the liquid is liquid. It's really the consistency of water, like I mentioned. So if you've got that patient that's squirmy, little child that's really hard to treat, it's hard to get it in there and get it on there without it flowing throughout their mouth, dripping on their face, dripping on your countertops, and that causes some staining issues. So that's something where the gel's been nice for those areas where you want more control with it. It won't drip off the brush. It stays on there until you push it right onto the tooth. So that's been a nice, exciting innovation. But yeah, Elevate's got some exciting stuff coming out with SDF here, probably in mid-2024. So keep an eye out for that. That's all I'm going to say.
Just in time for RDH under one roof. That's
Right?
what it sounds like.
Be there or be square.
With the application, is there any sensitivity to the soft tissue if like the SDF gets on the soft tissue? For instance, if you're trying to arrest like interproximally, do you need to apply anesthetic? What does that look like?
So that really depends on the product that you're using. So here in the United States, there are 2 silver diamine fluoride available. There's the Advantage Rest from Elevate Oral Care, which is sold direct from Elevate. So you won't find that through your distributor, but that one has a pH of 10. So there's no issues with soft tissue, anything. You can just simply cotton roll, isolate the area, apply the SDF. If it gets on the soft tissue, whether it's the gingiva, their lips, cheeks, fingers, anything like that, it will temporarily discolor that. Intraorally, it goes away in like a day, and it'll look like an amalgam tattoo or like a henna tattoo. Extraorally, it can linger just a couple of days longer than that, but it goes away and it causes no issues to the soft tissue. The one that you want to just be aware of, the other product, the Revastar product, which that one is the 2-step that you mentioned earlier, Amanda. That one has a pH of 13. So they do recommend that you use some kind of a gingival barrier like a rubber dam with that, because it does have a higher pH and can cause some soft tissue burning.
Okay.
Yeah.
Yeah. My doctor started using that, and he was doing local anesthesia and some serious isolation. So I was
Mhm.
curious. I was just based off of my comparison with silver nitrate. My doctor didn't have to do any local anesthetic, but of course staining was crazy.
Mhm.
So I was just curious about that.
And I think that's a good question. And that's something when you're looking for this minimally invasive option, you really want to find something that's as little, as minimally invasive as possible. So if you can avoid the rubber dam, if you can avoid that local anesthetic, that's really the beauty of SDF. So yeah, something to think about.
Definitely.
So Haley, I want to go back. So if there's no decay, there's not going to be any staining. If there
Nope.
is decay, it will be black. But you said something about demineralization. What does the tooth look like after when we apply SDF?
Yeah, so if there's any decay or demineralization, it will stain that area. Yeah. So hypomineralized teeth, it'll stain. So if there's any kind of decay or demin, that's when you will get that discoloration, which is permanent in the tooth. But on the flip side of that, with, like I just mentioned, the hypomineralized teeth, like those patients are incredibly sensitive. So yes, it will stain those areas, but this becomes a godsend for some of those patients because it treats their sensitivity as well. Really helps with those. But yes, any demin, decay, that stain, but not healthy tooth structure. So Amanda, your doctor that was wondering if you had any little sticky spots, you can really almost in some sense, not that you would do it this way, but it's almost can be used as like a caries disclosing solution because it's going to stain and then, hey, there's your issue, doc.
I feel like he would be
Found it.
game for this. He's fresh out of school. So I feel like the spirit of let's explore, let's see.
It's there.
I
Yeah,
think he'd be up for it.
go
So
for it.
I'll put him on some nitrous and
That's too funny.
I think we may have slightly talked about it, but how do you see SDF kind of evolving in the field of dentistry and like really creating this paradigm shift for hygienists and for doctors? Do you see anything drastically changing?
I think it just gives us more options, as I mentioned too, a minimally invasive option. And I really think long term, I think we're going to see patients less fearful of dentistry and coming to see us. I mean, patients don't like coming to see us, a lot of them. And a lot of that comes from when they were younger, they had bad experiences. Someone held them down, they did this drill and they put this shot in, and something that to a young child could be very, very scary. Whereas this can be like, hey, we're going to paint this fun little gel on your tooth and it's going to taste funny. We're going to cover it up with your bubble gum or whatever choice you picked out for your varnish and you're done. I mean, so we can really make it so, and then like it could be so much fearless for these patients and they can, come in and get this done. And if down the road, then they're ready to do that restoration too, it can kind of really be used to buy time for patients to, get them through from being really young to being, okay, they're 8 years old. They can easily sit through this now and we can do a traditional filling if that's what the, patient wants or mom and dad wants for that area. So could buy time. It just gives options too. Like I've recently been bringing up this story about my mother-in-law because just a few months ago, she's retired now and she's in her 60s, I want to say. She's has, good oral care. She's always been to the dentist regularly and she's never been one to get cavities. But of course, now that she's retired, she no longer has dental benefits at all. And she's like, oh my gosh, I went to the dentist and I have a cavity on this tooth. And she was talking about one of her lower molars. And I'm like, oh, well, that's a bummer. And she's like, guess how much he's charging me for this filling? And she read me off the notes and it was like a DO and it was a couple $100. I'm like, that's totally normal. And she was just like appalled at it. And I'm like, well, let's do STF. And she's like, can we do that? And I was like, of course you can. And, explaining it to her, but she is going to have this stain. It's in the back tooth, but you cannot see it. Like we got out the mirror and I'm like, talk. And like, and she kept looking back. I'm like, you're not going to see it. And she's like, I don't even care if I see it. She's like, if this is going to cost me $40 here and there, like I'd much rather do that than pay this couple $100 for back here for something that she's had restorations through her life where a lot of time, somebody recently was saying as soon as you take a drill to the tooth, it's the death cycle. Like you're starting this death cycle. You start with this little occlusal lesion that eventually grows to a DO and now it's an MOD and now it's a crown and an implant. And now that tooth needs to be extracted. Like it's just this cycle, whereas we can really stop that if we can just paint this on. So I think that this can really help shift a lot with dentistry and help people be less scared, give people more options. I just think it's a really another, like I said, just that great tool we have now, and an additional tool in our tool belt. So I think it's beneficial.
I love what you said, and I feel like that could be a whole other topic that we could just nerd out on. Just that progression of, we have such a flippant attitude about, oh, I have cavities, oh, whatever. And it's like, well, cavities aren't normal. It's not normal for a tooth to rot in your mouth. There's a problem there. So again, that could be a whole other discussion, but yes, it is essentially, and I started telling my patients as well, like, it's essentially like you're taking an hourglass and you're turning it over. The life of the tooth is now kind of trickling faster and faster, and it depends so much on what you do at home. So anyway, I digress, but I love what you said about having options and being able to give patients options, because we live in such a time and age where the internet is accessible. There's such a good chance that patients may have heard something about this. I think I actually did have a patient bring it up to me, and I was like, I don't know about it yet, but I will. So I have a report to write for a patient coming in a few months. But it kind of blew me away, because I'm like, who the heck knows about SDF? It's not something that's commonly known in our world, much less out in the general population.
You're right.
So I think that's going to be fantastic to be able to offer that to a patient as a hygienist, but obviously knowing my situation where I think I have a doctor that's going to be very pro this, I have no doubt that I will become adept in SDF.
Well, I'm here to help anytime.
Hayley, I'm doing student presentations, and I'm traveling across the country now, visiting schools, talking to these hygienists before they graduate. And I'm headed to New Mexico next at the end of the month, a very rural area in New Mexico. We're going to be in San Juan. And I already am thinking I have to update my presentation that when I talk about fluoride, I need to pair it with SDF for that lower, a low income population. That this is right where it needs to be. So I'm like thinking already, Hayley, I have to put this in my presentation.
Yeah. No, for sure. Rural areas, this can be such a game changer, because those patients, that you can, again, let's say they still want that restorative treatment done, but it takes them hours to get to their closest dental office and whatnot. So this can be applied, and again, buy them time until they can come back. And think about the investment that patients have when it comes to their mouth and they get restorative work, or if they've done braces or anything like that. The last thing they want is to let all this restorative work fail. And so you can also apply this around, restorations and things like that to prevent recurrent decay from happening, and to keep those restorations in there. But yeah, I think with going around to those schools, and especially if they're dealing with that rural population, this can really help for sure.
Yeah.
There was a pretty neat study recently that came out, and there's a really great podcast on ADHA did a podcast on it, where they had Dr. Jeremy Horsekeeper, who's a big SDF researcher and a pediatric dentist. And then they had one of the head researchers of this study that was done. It was in New York. It was the largest school-based study, and they were trying to compare how effective silver diamine fluoride and fluoride varnish was versus your glass ionomer sealant and fluoride varnish in children. So it was like 3,000 children in the state of New York. And the really neat thing about it was these applications of the SDF were done by hygienists and school nurses, because it is just the most foolproof application. Anybody can do it. It's very easy. So these school nurses who have no oral training, they were just trained on how to apply SDF, which takes no time at all. And they found that the SDF and fluoride varnish was just about equivalent to the preventive benefit they saw of glass ionomer sealants and fluoride varnish. So to know that in like these rural areas, school nurses can be doing this, imagine how this will improve access to care for so many. School nurses can't do sealants. They just can't. They're not trained that way. They can't do it. I don't believe they're even allowed to. Whereas medical professionals can do silver diamine fluoride. They just got a CPT code for silver diamine fluoride was just approved for any healthcare provider to apply silver diamine fluoride. And just think about that, what that will do for access to care, like I'm saying, for these people in these rural areas where the only person they do see is a local nurse of some sort. So that could greatly help prevention of caries and treatment of caries.
That's very interesting. How long is like SDF shelf stable?
It just, again, depends on that product you have. So our Advantage Rest product is has a 3-year shelf life, and the Revastar product has a 2-year shelf life.
Okay. So not wildly volatile or anything.
Yeah.
Okay. On the note, you kind of threw out a study there, but what are some other links and resources that other people that are interested in learning more, researching a little bit more about SDF could find?
Yeah, absolutely. I would even recommend just starting with our website. If you go to elevateoralcare.com, we host webinars on our platform almost monthly. They're free and you get CE credit. You can view them on demand, or you can follow us on our social media, and we let you know that when there's an upcoming live one in case you want to ask any live questions and things like that. But otherwise, you can watch them on demand. And we have several on silver diamine fluoride. And again, we bring in outside experts and researchers. Like I mentioned, Dr. Jeremy Horse-Keeper has been on a lot. There's a pediatric dentist in Arizona who is really become an expert on SDF, Dr. Jeanette McLean. She's done a couple of our webinars on SDF. So we've got a lot of great resources there. And then we also have a team of preventive care consultants throughout the country. Most of them are hygienists themselves. So they've been there, they've used a lot of these things personally, and they've had a lot of great experience with it. So they can come into your office and do a staff meeting for free CE as well. But also, if you just research out there, I mean, it's hard to pick up a dental magazine now or journal without seeing some information about silver diamine fluoride, which is pretty neat to see. So there's no shortage of research here in the United States and beyond on SDF.
I mean, free CEs, why not?
Right,
and plus direct from the source. So I definitely love that.
Yeah.
Okay. My doctor specifically had 2 questions that he wanted me to ask about SDF. So he was curious to know about the long-term effect of a tooth treated with SDF. How long can it last? And not just, I think, on the occlusal, but like an interproximal arrest. We'll go with that situation.
Sure. Yeah. So this works great for interproximals as well. And as long as it can be applied to the interproximal area. So if you have a really tight contact, a really great way to treat that is with super floss, where you thread the floss through there first, apply the SDF to the spongy portion of the floss, pull it through and let it sit there and soak into the interproximal. And then after that, just remove the floss. So that's a great way to treat it. Or you can also just take an applicator brush and push it in really from all angles, from the buccal, the occlusal, the lingual, push it in there and it will penetrate through there and arrest the lesion. So it's great for interproximals as well. And you can, treat interproximals. The research will show you, though, the more cleansable the lesion is, the better this works. So obviously it's going to be much easier to treat and be sure the area is treated on like a facial surface and occlusal surface. Obviously interproximals are a little more tricky in the sense because you can't really get in there to make sure it's hardened, it's remineralized, it's black. And x-rays don't do a lot to tell if this is treated. So that's the one tricky part too. Radiographically, it'll kind of appear like a scar on the radiographs. You might notice some slight improvement in the radio opacity, but for the most part, it still appears pretty radiolucent. So that's just where documentation of the product is key. You just want to make sure you're documenting that you've arrested those lesions with SDF and you are continuing to monitor and reapply it as needed. And that is something, as I mentioned earlier, it does leach out. So it's not like a one and done thing. You want to apply SDF. And ideally, you would bring the patient back in within no sooner than a week. So at least a week to a couple of months, and you want to reapply it. That's kind of like a loading dose of your antibiotics in a sense, where you are just reapplying it to be sure the area is arrested. And then from there, you just kind of want to keep up with monitoring it. And typically you want to reapply it like 1 to 2 times a year. So moving forward until it's either restored or until that tooth exfoliates. So as long as you're keeping up with those applications, the life of that tooth looks great. You're keeping up with applying it, making sure it's arrested. It also has that preventive benefit we talked about. So you're also creating that antimicrobial tooth structure. So when you've applied it to that, you're really taking these highest risk sites or these infected sites and turning them into one of the safest sites in that patient's mouth. So the longevity of that tooth looks great as long as you're able to see that patient back, make sure you're reapplying it because that silver will leach out over time. So yeah, it looks great. Interproximals are where it gets just a little more tricky, but there's a lot of great success with it. That's just going to be the area that's not as successful as others just because of how hard it is to check on it.
Difficulty of application as well, I would definitely say.
Yeah, for sure. And just how hard it is for that patient to keep it clean. That's their hardest spot to keep clean over time as well.
Okay, another question that he had, what effect does it have on bonding composites because it helps to occlude dentinal tubules?
So that's a good question. And one we get asked all the time is, how does this affect bond strength? So the interesting thing is it's not really known why, but it will actually improve the bond strength with glass ionomer, and it does not affect composite bond strength one way or the other. So you can absolutely restore over this as early as the same day. But if you're looking for the most aesthetically pleasing restoration, you want to wait at least a week's time before you apply your restoration over it. But it won't affect the bond strength either way. I mean, it's great to use it and bond over it. But I will say, like I was talking about, the aesthetics of it, if you're placing any kind of a light cured material over the SDF, that's really the only time it's recommended to light cure your SDF first. So typically we don't light cure it, but if you're placing a light cured material over it, like let's say you're sealing over it or you're placing that composite over it on the same day, light cure your SDF just for like a quick 2 to 3 seconds. And that will help to assure that none of those silver ions will get mixed into your restorative material and cause any of that to stain or discolor.
You just made me think of something that I had not even thought of before. So not only are you basically saying you can apply a sealant over the SDF?
So SDF is an antimicrobial. It's an incredible antimicrobial. So Joffrey, when you go to see your students in New Mexico and beyond, that's one of the neat things about when you're talking about fluorides. You want to talk about, sodium fluorides are great and they help restore the tooth. They prevent demineralization, but it doesn't do anything much, if anything, for the bacterial load. That's where your stannous fluoride and your silver fluorides come in because they're antimicrobial. So those, you still want to have that antimicrobial component. So yes, this will offer that antimicrobial benefit to that occlusal surface. So you can do this before you seal as well if you want. If you really want to have that sealant on there, then yeah, you can do this before you seal and it'll be like an antimicrobial to remove any bacteria before you place that sealant. But yeah, just light cure first if you're going to do that on the same day.
Interesting.
Yeah.
Interesting.
Yeah.
Okay, so Hayley, it's no secret that I am a huge fan of your guys' fluoride. It is like my absolute favorite fluoride on the universe. And
it is the best texture.
It's good.
Yes. And I mean, we could have a whole podcast on fluoride, but I want to know, Hayley, do you think later on we're going to see like a combination product of the two, like SDF with the liquid varnish?
I don't think you're going to see a combination with that particular product, just because there's fluoride in the silver diamine fluoride, and that formulation they figured it out. Like it works great, and then you can cover it with fluoride varnish. I don't think that you're going to see a combination with that, but I think you will see a combination of with maybe some of our other products in the future. But again, that's all I'm going to say.
that are coming mid 2024.
Yeah.
She has us at the end of our seats.
But yes, in all seriousness, if you have not tried Elevate's Max Varnish, you have got to try it. It's a game changer. It's so thin. Patients appreciate it. It's so cost effective. In the bottle system, it's like what, 40 cents maximum for fluoride varnish in your office. And that's at the most expensive price. It's really, really good. We've got some new flavors. It's a good one. I like it.
And just even on the consumer side of it, on the patient side, it doesn't burn because there's plenty of fluoride varnishes out there that burn the gum tissue. Like,
Yeah.
it's not a pleasant experience, and they taste horrific. And it's a hard sell to say, hey, can you spend $25 so I can make you very uncomfortable for the next 30 minutes to 4 hours? So
Yeah.
yes, I absolutely wish we could have your fluoride in
Oh.
our office.
Yeah, it's good stuff. And I mean, adults appreciate it. A lot of them go back to work. They don't want that big, thick film on there. It doesn't look like, if you're applying it properly, you don't hardly even see a thing on there. So it's cool.
Yeah, you don't. Joffrey, any other questions before we get to the final two? Or Hayley, is there
No.
anything that you want to add that we didn't ask you about
Let's
your
see.
products?
I don't
Open
know.
floor. Open floor.
I think to check Elevate out, we're like the leaders in prevention, dental caries prevention. So if you're looking for something, you know, we all have patients that are at risk for caries. The vast majority of patients are at moderate to high risk for caries. So really bring us into your practice. Let our consultants really consult with your team, not just on SDF, but just on caries prevention in general. We have a full line of preventive care products. And our team is very good at helping with communication with your patients, which can be so hard. They help with acceptance from your patients, where we feel like all day long we make these recommendations and sometimes we don't get patient acceptance. Our team is well trained in how to have those motivational interviewing or patient-centered communication to really help with acceptance of the treatments you're recommending. So again, it's free CE, and if you want to, try to get your team all on board and be a little more caries preventive minded, I would give Elevate a call, because we'd love to come in and meet you guys.
Well, and you guys are like a small company. You're mom, pop owned. You're not this huge conglomerate of anything. So I love that about your company personally. It's one of my favorites.
We appreciate that.
All right. Do you want to ask the
right.
last questions, Joffrey?
Yes. Okay, Hayley, what piece of advice do you wish you could go back and give yourself as a new graduate?
Ooh, a piece of advice would I go back and give myself as a new graduate? I would say be excited, be open to learning, because we learned so much in hygiene school for sure. So we kind of come out thinking like, okay, I know everything, but I mean, clearly everything is always evolving. SDF was not around when the three of us finished hygiene school. So things are always changing. So be open to learning, and really be open to those sales reps, because they may come in and have some great innovation that you might really want to know about. So I think having an open mind, always continue to learn. I think that's the advice I would give myself for sure.
Then let's see. We have one last one we love to ask everybody. What do you wish you would have learned in hygiene school that took you years to learn as a hygienist, whether it be in or out of the clinic?
Okay. What do I think that I wished I would have learned how many opportunities there are outside of the op too, because I didn't know, and I kind of was forced out of the op, not really, but because my husband traveled around a ton for work, and as you guys may or may not know, but going from state to state with a hygiene license is so hard. Literally, where I was moving from the West Coast all the way to the East Coast, the state we finally landed on that we're in now, I would have had to take another clinical exam, which I knew nobody out here to be able to find a patient that would work for the board. So, I mean, finally at that point, I'm like, all right, I guess this is it. I guess my career is over. And luckily I found a place where I could stay in hygiene, doing what I do with Elevate, where I'm not clinically chairside anymore, but I am still focused and using all the education that I had from hygiene school, and really loving this opportunity that I have. I definitely miss clinical hygiene some days. And when I go back to the states where I'm still licensed in here and there, I still pick up temp days every so often and cover for people. But so I still get that fixed. But I think it's neat to see how many opportunities there are outside of the op. And, you still use all your education and still bringing a lot to the profession and to patients. And it's neat to see. There's just so many great opportunities out there.
That's great advice, and very motivational, because unless you're exposed to those things, you don't know. You
Yeah.
don't know it all.
It's true.
Yeah, no one's had that response yet. I love that one.
Oh,
That was
yeah.
a great,
It's true.
great answer.
Well, good.
All right. Well, Hayley, thank you so much for popping on the
Yes.
podcast with us and sharing all that insight about the SDF. We appreciate it.
Yeah, thank
Definitely.
you guys so much for having me. I always love hanging out with you guys, even virtually this time. It's fun. But thank you guys so much. And yeah, it was fun to share some SDF. I love talking about it. So thank you guys. Appreciate
Thank
it.
you. We'll definitely have to catch up at Under One Roof.
That's right. With our new products by then, right?
Yes,
Yes.
true. True.
Yes, I'll look forward to seeing you guys there.
Sounds good.
All
Thanks so
right.
much, Hayley. It was nice